Hello, my name is Dr. Asha Subbalakshmi Musnori and I am Clinical Director and Head Medical Gastroenterology, Liver Diseases and Interventional Endoscopy and Endoscopic Ultrasound and ERCP Specialist from Hyderabad, and I have 26 years of experience in practice in this field. This video is being made for all my international patients who come from many parts of Africa like Sudan, Somalia, Djibouti and many other parts of Africa and Kenya and Tanzania and Middle East, Oman, Turkey, sometimes from South American countries like Cuba and also from Europe and Southeast Asia and also from United States of America, Canada and England. So hello to all of you, and in the Department of Medical Gastroenterology with my clinical expertise, we do everything from upper GI endoscopy, colonoscopy, removal of polyps from both upper and lower GI tracts. We do ERCPs for treatment of pancreatic and bile duct diseases, and we destroy stones. We do stone removals from the bile duct, which is next to the gallbladder, and I put metal stents for cancers both in the bile duct and in many parts of the body to relieve jaundice due to malignancies or cancers. And as far as interventions go, I do a lot of endoscopic ultrasounds to image the pancreas. These are relatively new techniques to see beyond the intestines through the endoscope, which has an ultrasound tip attached to it, an ultrasound probe attached to it, through which we see the gallbladder, the bile duct, the pancreas and many other parts of the body. And this is an area of expertise, and we have these facilities in Care Hospitals, High Tech City, Hyderabad. And we treat a lot of patients with precancerous conditions like polyps of the large intestine or colon, and also the small intestine and stomach and food pipe. For this, we remove the polyps with lasers and do techniques like placement of hemoclips after using the laser whenever required. We also treat a large number of patients with bleeds from the intestinal tract or stomach. They present as blood vomitings or black motions or blood in the stool. For this, after performing endoscopy, colonoscopy, we see the areas of bleed, and we, depending on what we see, we may apply bands for bleeding blood vessels like varices, or we may put glue into certain blood vessels, or we may apply clips called hemoclips, or do laser treatments depending upon what we see. We also do dilatation or narrowing areas. We dilate them, the strictures, which can be due to cancers or due to any other condition like acid corrosive drinkers by mistake, or any other cause of narrowing of the food pipe or the stomach. We use various devices to dilate those parts so that the patients can eat better if they have any difficulty in swallowing. Then we also do techniques called percutaneous endoscopic gastrostomy or PEGS for patients with nerve problems or neurology problems who cannot eat or swallow. We also do techniques like metal stent placements for colon cancers and for intestinal cancers. We also have equipment like enteroscopes to see into the small intestine, and we also have capsule endoscopy, which is a small capsule called a pill cam, in which a camera is attached, or it has a small endoscope in it. Once it is swallowed, it reaches the small intestine and takes about 3 images per second. That tells us areas of bleeding in areas that cannot normally be seen with endoscopy and colonoscopy. So these are some of the techniques we do in the Department of Medical Gastroenterology that I head and that I do. I'm also a specialist in liver diseases, and I treat diseases like hepatitis B, hepatitis C, cirrhosis of the liver, liver cancers, cancers of various parts of the digestive tract like cancer of the esophagus, stomach, liver and colon, and bile duct and gallbladder too. for which special stents called metal stents are sometimes placed to allow the patient to start eating normally. This will help the cancer doctors or oncology doctors to provide the treatment necessary after the necessary stents are in place. So, hello to all of you international patients. I am seeing at least about 200 of international patients per month from all over the world, and we welcome you to visit our center at Care Hospitals High Tech City and avail all our services. We are always with you, and happy World NASH Day, that is on June 8th, in honor of non-alcoholic steatohepatitis or fatty liver. A special day is being celebrated to raise awareness. Stay safe, try to reduce weight, don't stay obese to prevent liver diseases and fatty liver. Thank you.